student, teacher, and parent react to medical subculture.
Would you like to introduce yourself?
I'm Yash and I'm a high school student at Woodbridge Academy.
My name is Mr. Nala.
Okay, so do you know what you're doing here today?
I think I'm supposed to watch video.
So today you'll be reacting to a particular facet of medical subculture. A key folkway among medical professionals is the practice of sociable and helpful interactions with patients, also known as good bedside manner.
So the official idea is believed to have been acknowledged by Canadian physician William Osler. In 1889, he moved to the United States to become a chief physician at Johns Hopkins Hospital and founded the Johns Hopkins University of Medicine. He began the idea of having a medical residency where students trained in hospitals or medical settings help treat patients instead of learning just theory in a lab or classroom setting to build interpersonal skills with patients. He was likely inspired to do this when he went to Norwich in 1905 and ended up reading the works of famous physician Sir Thomas Browne. And Browne's works helped Osler understand the importance of characteristics such as empathy, tolerance, understanding, and perceptiveness when dealing with patients, which contributed to the modern concept of good bedside manner.
One of the most important values of medical subculture is altruism. Altruism is generally associated with generosity and a caring nature.
So, the concept of altruism was first thought up in the Hippocratic Oath by Hippocrates in 400 BCE. And the term itself, altruism, was first coined by Auguste Comte, a French positivist philosopher in the 19th century, as an ethical theory of conduct. And basically, it follows the belief of selflessness and putting the needs of others in front of your own, and it's a basic value that's followed by most, if not all, doctors, because their whole career is founded upon helping the sick recover and become healthy. And it's been such a major part of their career that it can lead to pathological altruism, where doctors become so invested into their career and work for others that their own health declines and leads to burnout, depression, and other stress-related ailments.
Today we have a clip from the popular TV show House MD, and we would like you to pay special attention to the bedside manner of the doctor.
Sounds interesting.
As you watch this video, pay close attention to these characteristics or lack thereof.
Let's do it. I'm ready.
No formula, just mommy's healthy natural breast milk.
Yummy.
I don't think doctors should be saying things like that.
No fever.
He doesn't seem very nice.
Glands normal. Missing her vaccination
You're not
dates.
vaccinated?
We're not vaccinated.
You kidding me?
Ribbit. Ribbit. All natural, no dyes is a good business. All natural children's toys. Toy companies, they don't arbitrarily mark up their frauds. They don't lie about how much they spend on research and development. The worst that a toy company can be accused of is making a really boring
It's like talking around her.
Ribbit, ribbit, ribbit. You know another really good business? Teeny tiny baby coffins.
Coffins?
You can get them in frog green, fire engine red.
That's crazy.
The antibodies in Yummy Mummy only protect the kid for 6 months, which is why these companies think they can gouge you. They think that you'll spend whatever they ask to keep your kid alive. Want to change things? Prove them wrong. A few hundred parents like you decide they'd rather let
Even
their
his
kid
tone of
die
voice
than
is
cough
like
up $40
demeaning.
for a vaccination. Believe me, prices will drop really fast.
You need to do all that. It's a bit extra.
Were you able to identify the violation of a folkway in the medical subculture?
Yeah, he was pretty mean and demeaning overall to the lady and her daughter. He could have explained all the scientific stuff that he wanted to explain in a nicer way to kind of urge her to do the right thing in the care of the patient. And especially because like she just had a cold, he didn't have to go like that extreme, especially when the mother said that they were against vaccination and things like that.
And what were some of your initial thoughts when seeing Dr. House's bedside manner?
I thought if that was a doctor in my room, like although he did seem very intelligent, he seemed like pretty mean and like rude, and I don't know if I'd go back to him again if he's like that kind of doctor. You know?
It's actually interesting that you say that because the next question is, how would you like to be treated if you were a patient?
Obviously, I expect a certain amount of respect when I'm speaking to my doctor, and I want a friendly doctor so we can engage in like normal discussion as well, and so everything's not strictly clinical.
So, Mr. Novel, were you able to identify the lack of altruism in the clip?
Yes, I was.
Okay, and how could the doctor have been more altruistic in that scenario?
Well, he was just talking about dead coffins for the baby, which that's crazy. You cannot be telling that to a parent or a patient.
That's very true, that's very true. So what are some of the core values of the medical field in your eyes?
I'm not sure.
Well, if you were to look for some characteristics in a doctor, what would you want to see?
Well, I would like to see some compassion. I would like to see maybe if he can explain me whatever I have in a different way, not just like, yeah, coffins, for you. No.
That's great. All right, thank you for your input.
You're welcome.
So, do you know why you're here today?
No.
Well, today you're here to react to symbols of the medical community. You're reacting to the caduceus and the rod of Asclepius. So, here are the pictures. So, you recognize these?
No.
Well, the caduceus is a symbol of the Greek god Hermes, which is basically the Greek god who symbolizes trade, commerce, and balance. And even though the symbol doesn't really symbolize medicine, it's often confused with the rod of Asclepius, which symbolizes medicine. So typically you see the rod of Asclepius on ambulances and other medical facilities, and the rod of Asclepius belongs to the Greek god of healing and medicine, Asclepius. But in 1902, a captain in the U.S. Army Medical Corps confused the two symbols and proposed to use the caduceus as the official corps symbol. And many years later, a librarian in the Surgeon General's office noticed this and brought it to new light. And it was allowed to remain as a symbol because people would often confuse the two. So eventually, the caduceus spread around the United States, and now both symbols represent symbols of the medicine. For the medical field. So what significance do these symbols have to you as a patient?
Well, these symbols represent a doctor, a hospital, urgent care to me. Doctors from the hospital will help our patients to get well from a sickness recovery, to get people well from all sorts of sicknesses.
So you're also in a special case where you are a mother and you have children. So what these symbols represent to you as a mother?
Well, a doctor will deliver babies, bring new lives to help parents to bring new lives to their family, bring happiness, bring hope to expecting parents.
Okay, perfect. So what significance do you think these symbols have to other doctors?
Well, they might be their inspirational career path, and that's their dream to be a doctor, to help out patients, to be selfless, to help people recover from significant sickness.
These symbols tend to have a positive connotation to them, how they represent health, healing, happiness to patients and other doctors. So do you think it has a similar connotation to the color of red in Chinese culture?
Yeah, I think the color red in Chinese culture means good luck. Just like in Chinese New Year, parents will give out red envelopes to their children to bring good luck to them in the new year. In Chinese weddings, the brides would wear red dresses to bring good luck for their future lives.
Hi, Tanvi, how you doing?
I'm great, but I'm very cold.
Well, that's why it's not you, right?
Yeah.
So, the culture that we chose to analyze was doctors' culture. And one of the main things that is prevalent among both doctors' culture and other cultures around the world is the concept of do no harm. So first I'll give you a little bit of history about the cultural universal as it's known. Despite the popular misconception, the Latin phrasing of this phrase, do no harm, is primum non nocere. And the Latin phrasing only dates back to the mid-1600s, and it's been attributed to Thomas Sydenham, according to the Journal of Clinical Pharmacology. This phrase gained widespread use in the late 19th century, and according to the Encyclopedia Britannica, it entered print by 1900. Today, it's probably the most recognizable aphorism in medicine, as both lay people and doctors have understood the reality and the necessity of their profession to first do no harm. So doctors often serve as the faces of the healthcare system to the general public across different cultures. In fact, they're usually the most trained healers, and the most trained healers are always entrusted with the greatest freedom and responsibility for their patients. So many cultures consider this ideal important enough to generalize to all people, but they retain the strictest penalties for the senior-most practitioners of medicine. In terms of the place of this aphorism in doctors' culture, as I said before, it's the primary goal of treatment. First, do no harm. By constantly keeping this in mind, doctors can determine whether the benefits of different treatments are worth the risks. So now what I want to have you do is watch a video on the laptop that's been set up over here. And, just learn about the guy. It's a biography of a doctor known as Dr. John Kevorkian, who is ethically very questionable for some of the acts that he's performed over the years. And afterwards, I'm going to ask you a couple questions, and we'll talk about it after the video, okay? All right.
What are your feelings on assisted suicide? Dr. Jack Kevorkian brought this topic to the nation's attention. Jack's actions brought up national debate on the ethics of euthanasia and hospice care. Dr. Deaths sparked an increased talk on hospice care and the right to die legislative action.
It's terrible.
Yep, as I said before, it is very morally questionable. Alright, so I gotta ask you a couple questions now. So what was your first reaction to the video? You think there's anything morally wrong with how the doctor acted?
I mean, I was horrified. You become a doctor, and it's your job to save the patient, to do as much as you can without putting too much risk on to the patient itself. And as a doctor, I feel that Dr. Kevorkian should have, out of all people, should have understood that he shouldn't have taken any part, and shouldn't have assisted in any of these suicides. 20 suicides.
Yeah, Dr. John Kevorkian, as I was describing before, he was very ethically questionable because his main job as a medical practitioner was to assist in suicides. And, he was eventually jailed for a murder as the United States Supreme Court decided that euthanasia is illegal in the United States. So, the United States Supreme Court already made its ruling, but do you see any ethical violations in the video? And do you think that those violations would stay violations in other cultures or other areas of the world?
Yes, I know, in fact, with the Samurai Code of Bushido, it was to love and respect all, and it was to also protect all non-violence unless the action was needed to be taken. And it was supposed to say it was an honor to become a samurai, and it's like the best position that you could ever have. And to uphold that honor, it was to be respectful and to be loving to all. And as a doctor, going back to what you were saying with the no one's harm, it's morally unjustifiable how a doctor could assist in any sort of risk to a patient.
So, just to recap for a second, you think that the doctor's concept of doing no harm and the Japanese Bushido Code are both similar in that both require that you do as much as you can to prevent harming other human beings and to always do your duty first, rather than to follow whatever means is necessary in order to treat the patient, even if the risks are greater than the benefits?
Yes, to not harm any living things and to respect everyone above yourself.
Interesting. Yep, I agree with you 100%. All right, thank you very much.
You're welcome.